Hi everyone, welcome back to the last video of this week lecture. In this video, we will discuss the other sedative and hypnotic agents, or we known as atypical sedative and hypnotic agents. Benzodiazepine-like substances such as zolpidem, xaleplon, and zopiclone, known as Z drugs that bind to alpha-1 subunit of GABA A receptor on pentameric chloride ion channel, which this binding will enhance the chloride channel open to a greater extent or for a longer period of time, which lead to hyperpolarization and increased CNS depression. It also can cause decrease the reticular activating system activity in the brainstem, which in turn cause a strong hypnotic effects. Unlike benzodiazepine, Z drugs are weak anxiolytic, weak muscle relaxant, and weak anticonvulsants. Xaleplon is short-acting and help those having difficulty to falling asleep. Zolpidem is most widely prescribed hypnotic agent. The side effects of these Z drugs including the dizziness, anterograde amnesia, confusions, hallucination, and somnambulism or sleepwalking. However, Z drugs are preferable than benzodiazepine because they cause less severe adverse effect, lower tolerance, lower dependence, as well as cause little disruption to the normal sleep cycles. Okay, let's recap back what you have learned in the sleep-wake cycle through the circadian component. Pineal gland can be found in the epithalamus of the diencephalon, which can produce the melatonin. The production of melatonin is stimulated by the darkness and inhibited by the light. Melatonin production not only helps to give you a feeling of sleepiness, but it also functions as an antioxidant within the body. Ramelteon is a melatonin agonist at MT1 and MT2 melatonin receptors at suprachiasmatic nucleus in the brain. It helps to promote sleep onset, and it should be taken 30 minutes before the bedtime for the best therapeutic effect. Tasimelteon is another selective melatonin agonist that binds to MT2 agonists used to treat non-24-hour sleep-wake disorders. This condition is disruption in the circadian rhythm due to misalignment with the light-dark circles and most often occur in the blind individual patients. The newly FDA-approved drugs, which are the suvorexin as well as the lemborexin, are the orexin antagonists that used in the treatment of insomnia. The orexin neuropeptide, as been taught last week, is a neuropeptide that promotes wakefulness in the brain. These drugs act as antagonists that suppress the wake drive in individuals to onset and maintenance of sleep. Diphenhydramine as well as the doxylamine are the only antihistamine that are recognized as generally safe and effective for use in non-prescription nighttime sleep aids. Both drugs have half-lives about 9 to 10 hours, which can be prominent residual daytime sleepiness when taken as a sleep aid. However, they have undesirable side effects such as the anticholinergic effects that make them less preferable, less useful than the benzodiazepine, as well as the compared to the atypical sedative drugs.